Good afternoon, everyone. This is Chip Rogers, President and CEO of the American Hotel and Lodging Association. I'd like to thank all of you for joining us here today for an important and timely update on COVID-19 with the Center for Disease Control and Prevention. Now, before we get started, I want to remind everybody that this webinar is for hoteliers. It is not intended for members of the media. If you are a reporter, please disconnect at this time. COVID-19, or the novel coronavirus, is a rapidly evolving situation. AHLA has been and will continue to be and work closely with government officials, public health leaders, and industry experts to keep you informed and to share tools and resources to help you navigate the issue. If you have not already, please visit our website, ahla.com/COVID-19, for the latest resources for hoteliers on how to prepare and respond. With that, we are very pleased today to be joined by Dr. Jay Butler. Dr. Butler is the CDC Deputy Director for Infectious Diseases. In his capacity, he provides leadership to the efforts of the CDC's 3 infectious disease national centers and helps to advance the agency's cross-cutting infectious disease priorities. Dr. Butler has 30 years of experience in increasingly complex public health leadership and management positions. After completing CDC's Epidemic Intelligence Service in the Wisconsin Division of Health, Dr. Butler completed a preventative medicine residency with the Respiratory Disease Branch of the National Centers for Infectious Diseases and an infectious disease fellowship at Emory University. He is a board-certified member in medicine, pediatrics, and infectious diseases, and has served in public health positions at federal, state, and tribal governments, including completing more than 22 years in the Commissioned Corps of the U.S. Public Health Service, from which he retired as the level of Captain Medical Director in 2012. Before I turn it over to Dr. Butler, I wanted to note that if you would like to ask a question of Dr. Butler, please use the QA box that is on the bottom of your screen. Following his presentation, he will try to answer as many questions as he can. Dr. Butler, we recognize how critical this time is for you and your colleagues, and we are grateful for your participation today and sharing valuable insights to the hotel industry. Thank you. Dr. Butler, it's all yours.
All right. Well, thank you, Chip, and thank you, everyone, for taking time out of your busy schedules to have this discussion today. I'm going to start by just sort of going through a bit of, how did we get to where we're at today, and then we can really focus the discussions on what may lie next. I think everyone's aware that the novel coronavirus emerged out of Hubei province in central China in December, which is an important part of the story to keep in mind that we're talking about a disease that was only recognized only 3 months ago. As we look globally now, I think everyone's aware that yesterday the WHO began using the word pandemic for this global epidemic. And I think that's entirely appropriate. Anytime we're talking about a brand new virus to which the human population appears to have little or no immunity and which can be transmitted person to person and can thus spread around the world, the term pandemic is entirely appropriate. As of today, globally, roughly 120,000 cases have been confirmed. We can be confident that there are more cases than that because there are milder cases that go undiagnosed. Globally, roughly 4,000 people have died as well. Over the past 15 days, we've seen a major shift in the epidemiology as the majority of cases have been diagnosed outside of China rather than within China. Even though China represents the vast majority of that 120,000 cases, there's now about nearly 40,000 cases that have been diagnosed outside of China. The areas that are now the hotspots for new transmission are in the eastern Mediterranean area, emanating from an epidemic that started in Iran and spreading to other countries in the Mideast, and then also in Europe with spread to North America, starting from an epidemic that started in northern Italy. Today, over 10,000 cases have been diagnosed in Italy. In Iran, which I mentioned earlier, nearly 10,000 cases. In Europe, though, which I think is really the hot spot right now, there have been over 2,000 cases in France, over 2,000 in Spain, over 1,500 in Germany. So we're certainly very interested in what's happening around the world because we know that this is a virus that has the capability to spread. And while the early response has focused on containment measures, we really are in the process now of transitioning to mitigation. In other words, how do we limit the impact of this pandemic, not only on health, but also on social structure and the economy? Here in the United States, we've had over 1,200 cases that have been confirmed, and we estimate that this is an underestimate. There have been cases reported or confirmed now from 44 states, as well as New York City and the District of Columbia. Unfortunately, nearly 40 people in the United States have lost their lives to COVID-19. The majority of those were residents of one long-term care facility in Washington State. But we do know that there are other long-term care facilities that are seeing cases as well around the country. The people who are at highest risk of severe illness are older individuals. As we look at what's happening in the United States, and we also look at the experience in China over the past 2 months, it's very clear that people who are more advanced in years are at much higher risk of developing severe symptoms and being at risk for death. There also is an increased risk for people with chronic heart, lung, or kidney diseases, as well as those with diabetes. The response is now in a transition to more mitigation, which is focusing on issues surrounding what can everyone do to take steps to protect themselves, which are really non-pharmaceutical interventions. This is different, say, from a bad flu year in that we don't have a vaccine currently for this type of coronavirus. And we would not anticipate that there would be one widely available for at least a year to a year and a half from now. There are some antiviral drugs that might have activity. There are none that are approved for that use, but there are studies that have started to be able to evaluate some drugs that exist now, such as an antiviral drug, remdesivir. That particular drug is also available under a compassionate use protocol from the FDA for people with severe illness. The things that then are still in our toolbox for what to do focus on steps that all of us can take, and it's important to understand how the virus appears to be transmitted. What we know about transmission is based on what we've observed with spread of the pandemic around the world, and also what we know about the other coronaviruses. During Chip's introduction, he talked about the novel coronavirus, and the reason it's novel is because coronaviruses are not new to science. There's actually dozens of coronaviruses in nature. Most of them infect various animals, but there are strains that infect humans. There's 4 that are known to cause fairly mild cold-like symptoms. There's also 2 that cause severe illness, the SARS coronavirus and the MERS coronavirus, the cause of Middle East respiratory syndrome. The novel coronavirus, or COVID-19 virus, is in the spectrum between those 2 ends. It appears to cause milder illness than SARS or MERS, but it's more severe than what is normally caused by the common coronaviruses. The mechanisms of spread appear to be primarily respiratory droplets, by which I mean when someone coughs or sneezes, there's a spray, and those droplets are potentially infectious. It does not mean that the virus is spread through the air, though. We believe that it's primarily transmitted when someone coughs or sneezes onto another person, but also there may be some potential for spread through contaminated surfaces. Let's say, for instance, that I've coughed into my hand and then use a touchpad, and someone else uses the same touchpad 30 seconds later. It's possible that they would have contaminated their hands, and then they get an itch in the eye. It's possible that they would then inoculate themselves. So a lot of the focus on steps you can take is on hand hygiene, washing your hands with soap and water for at least 20 seconds, or if soap and water are not available, using a alcohol-based hand gel with at least 60% alcohol to decontaminate the hands. Other steps are staying away from people who are sick, and also because the symptoms can be very mild, particularly if you're at risk, we would recommend avoiding crowded situations or mass gatherings, and potentially deferring travel, particularly if you're older or have underlying illnesses. The other thing, of course, that's important is our advice to people who become ill, recognizing that the majority of people will not require hospitalization and will be caring for themselves at home, and that is to isolate yourself away from others and to not go out in public while symptomatic. We are working hard to figure out the best time of when ending that self-isolation is appropriate, but it's important to recognize that it does appear that it's maybe possible to transmit the virus for a short period of time after symptoms resolve. Maybe at this point, I should pause and see what questions people have. I've tried to anticipate what some of those questions would be, but I'm sure you have many more. And again, let me thank you for taking time. I know everybody on this call is dealing with it in your community. If you're not yet, it's very likely that you will be soon as this pandemic continues to progress. So, Chip, I will turn it back to you then, I suppose.
Dr. Butler, thank you so much for your comments and more importantly, your work on this issue. We do have a series of questions, and again, for everybody that's participating, keep in mind the QA box at the bottom of your screen is how you would ask a question. We'll start with this. What is the current CDC guideline for hosting of large meetings and events in the U.S.?
Yeah, that's a great question, and certainly is one that impacts the entire hospitality industry as well. So we've recently, actually on Tuesday, put out some framework for community mitigation measures that includes addressing the factors around mass gatherings, even gatherings such as faith-based services, and also conferences. It's very clear that mass gatherings are an opportunity for many people to become infected and to spread the infection even more broadly. So we really do advise that mass gatherings be reconsidered for either altering or for postponement, depending on the particular situations. An example of an alternative to postponement would be to hold, let's say, a sporting event without spectators. So the number of people who are gathering together may be kept to a minimum. The decision really needs to be made locally based on what is happening with the epidemic in that location at that time. Not only would we not want to move on some of these things too early, we also would not want to continue them too late. And that may be a little hard to see at this time, but at some point this epidemic will be on the downward curve once again. It also depends on the nature of the gathering. If the gathering really is more likely to have an older age demographic, I would tend to want to lean towards postponement or canceling, because you really want to avoid a gathering with a large number of people who are at high risk. Also, a gathering that requires a lot of travel from various parts of the country or internationally might also be more important to consider whether or not distance delivered program or cancellation is an option in order to limit the amount of spread of the infection. And let me just say one other thing very broadly about community mitigation. We recognize that containment is something that we do early in the course of the epidemic. The overall goal of both containment and mitigation is to limit the impact of the pandemic. In other words, to spread it out over as long a period of time so that the disruption of community life as well as the impact on the healthcare system can be spread out over a period of months rather than weeks, so that it's not overwhelming. And that's particularly important for the healthcare system, which may not be able to manage several thousand patients hitting the doors over a 2-week period, but may be able to absorb it over a 2-month period.
As a point of clarification, Dr. Butler, when you define mass gatherings, is that 1,000 or more, 250 or more? What would you consider a mass gathering?
Yeah, it really does depend on the nature of the gathering. In one of the documents that we have posted, we have used as an example 250 individuals. I know some locations have used smaller numbers, so it again depends on the nature of the contact. In general, the more at-risk people and the closer the contact, the more we would recommend considering cancellation.
So, for example, 1,000 18-year-olds outside in a park would be far less dangerous than 250 80-year-olds in a confined space, right?
I think that's a very accurate statement. The caveat in that is what the 18-year-olds do after they get back home. If they all become infected and then go visit Granny in the long-term care facility, that could actually have a very bad outcome.
Well, as the father of a couple of children around that age, I'm always wondering what they're doing, but we'll move on to the next question. What is the current guidance?
I hear what you're saying there, sir.
Yeah. What's the current guidance for remote work or telework?
Yes, and the CDC has provided some guidelines on teleworking, and very broadly, we would recommend that, and I think it's an important part of what all businesses do to prepare, is to be able to have liberal telework policies to encourage that as much as possible. This provides the opportunity for people to social distance and also to be able to self-isolate if they become ill, and this would limit the transmission in the workplace. Here at CDC, we're actually encouraging that and even piloting some partial complete telework policies as a test of that system at our own agency. Clearly, some activities aren't going to work, such as operating the laboratory. That can't be done at home, but a lot of other support functions, as well as the epidemiological work, has the potential of being done from home.
Another question. We hear a lot of discussion about the creation and ultimately the distribution of a vaccine, and we understand that that's, as you indicated earlier, a year to year and a half away. But are there any drugs that are currently available or could be available in less time that could lessen the severity of the virus?
Yeah, so let's start with, actually, let me amplify a little more about the vaccine. There actually was a vaccine that was developed against the SARS virus back in 2003, 2004. Fortunately, that was a virus that is most likely, even though it caused more severe illness, it was less transmissible than the COVID-19 virus. And that epidemic ultimately was contained. There was no cases of SARS identified anywhere in the world after 2004. So the vaccine never saw any kind of mass production. Building on the platform of what was learned about coronavirus vaccines in that experience, we would anticipate that it may be possible to have the first vaccine for human trials available in the next couple of months. However, the time that is required after that is for assessment of safety and effectiveness, so that if we're promoting a vaccine for prevention, we can be assured, as well as the American public can be assured, that it's going to prevent the majority of infections, and that it's going to be safe to receive. So those type of trials do take time, but they're a necessary part of developing a vaccine and being able to reassure everyone that it's a good idea to get it. In terms of drugs, there are some candidate drugs. There are none that are currently FDA approved, none that are available anywhere in the world really for routine use. but there are a number that are in studies. I mean, the particular one I mentioned earlier, remdesivir, and that is in some randomized trials, both in China and now in the United States. It's also been made available for people with severe illness under what's called a compassionate use protocol from the FDA. There's ongoing work to look at other antiviral drugs as well as monoclonal antibody products. And a monoclonal antibody is basically taking the, being able to recreate the immune response to the virus in a way that it could potentially treat it. So it's a little different than, say, getting a vaccine where the immune system is tricked into believing it's become infected and cranks out antibodies. This is a way in a laboratory to produce the antibodies so that they could be administered to someone and may potentially have therapeutic value. In other words, value for treating people who are already infected.
Excellent. Next question. How long does the virus stay on a contact surface? We've heard a lot of different numbers and want to ensure that we have the most accurate information.
Yes, and that's an area I know that's quite, can be confusing. I think in general, pragmatically, it's best to think in terms of minutes to hours. Under laboratory conditions, it's possible to have the virus recoverable after a period of days. The epidemiology or the patterns of disease don't really suggest that the virus remains transmissible for prolonged periods. And we look particularly at the early days of the epidemic when we were first starting to see spread out of China. Practically every case that occurred was associated with, outside of China, was associated with exposure to someone who is symptomatic with COVID-19 after returning home. If this were a virus that, say, survived for days on the mail or on products that were produced by someone who was infected, I think we would have seen more rapid spread of the virus and also have seen it suddenly pop up in different parts of the world without the connection to travel that we actually observed. In terms of what does that mean for what should we be doing at home or in our businesses? I think the important surfaces to think about are frequent touch surfaces. So that would be things like, I used the example of touchpads earlier, but also counters, doorknobs. And the coronaviruses are susceptible to routinely used household disinfectants. So things like bleach or alcohol solutions should be effective.
How long should we anticipate the level 3 travel alert staying in place?
Yeah, that's a great question. It's always hard to make predictions about the future. That was Niels Bohr, the nuclear physicist, who said that. And it's right now, I know the discussion, particularly about the European restrictions, it's at least initially been proposed to be 30 days. I think it really depends on how the pandemic continues to progress. So at this point in time, I really could not answer that question. I think the goal would be we always want to use the least restrictive means possible. So I think these restrictions would be lifted as soon as possible, but when that is, we can't say at this point in time.
Doctor, we've heard a lot of people, and I think it's hopeful and wishful thinking, and myself included, believe that when the weather gets warmer, that this may go away like a lot of other viruses go away. Do we have any evidence of that?
At this point in time, we certainly don't. I mean, this is a virus that probably literally evolved and entered the human population only about 3 months ago, maybe a little longer than that. So it's actually not experienced a summer yet. And how the the warmer weather in the northern hemisphere might influence the epidemiology during the pandemic is really unknown. Certainly the experience with flu pandemics is encouraging that we might see a bit of a break over the summer. I think it's really too early to say whether or not we could see that with coronaviruses. In terms of our own planning here at CDC, our philosophy is always to hope for the best but prepare for the worst, and so we are certainly moving forward under the assumption that we're not going to see a let-up over the summer months.
Dr. Butler, we'd like to turn to the QA box now, if possible. Do you have access to some of those questions?
I have somebody here who I've just been passed a note.
Good.
So one question is regarding hotels. What agency should they report a guest or an employee to who tests positive? The broad answer to that question is your state or local agency. And the responsibility for reporting is variable in different states. In general, it's a responsibility of the healthcare provider rather than the employer to do that. If you have specific questions or concerns about a guest or employee that you're worried about their health status and that they may need testing, again, your state or local health department is the best contact.
Do you want me to read the question?
Yeah.
Okay, I'm going to read the questions. Hi, everybody. This is Rebecca Gold. I work with Dr. Butler.
And she can read her own handwriting.
Nobody else can read my handwriting. That's fair. If this is new, why does it say that the coronavirus is killed by Lysol? That's been on their can for years.
Yes, and that is because the family of coronaviruses has existed for years. In fact, the first two coronaviruses known to infect humans were first isolated in the 1960s. We currently have no evidence that this coronavirus behaves any differently than the other 6 that can infect humans, or as far as that goes, the literally dozens that infect animals of agricultural importance. In fact, just passing comment, if you've ever looked at closely at your veterinary bill, you may have even seen that your dog received a coronavirus vaccine. That's not this coronavirus, and not really it's not a strain that causes any known disease in humans. So there's a lot of experience with coronaviruses, and even the limited lab experience suggests that this one behaves in response to disinfectants the same way as the others.
Thanks. What are some of the best practices for cleaning rooms of guests that have shown symptoms?
Okay. So cleaning of rooms involves using some of these household disinfectants, such as what we've described already. The question that also oftentimes comes up is personal protective equipment that may be required. And it's not a risk so much of exposure to the virus, which is not known to float in the air but may be present on surfaces, but whatever PPE that may be required to use with the disinfectant. To date, we're not aware of instances of transmission to people who are cleaning even hospital rooms where people with COVID-19 have been housed. There has been some work of culturing the environmental surfaces in hospital rooms. It is possible sometimes to isolate the virus in those situations, but the risk of infection is thought to be relatively low. It talks about letting the room air out.
For 24 hours. Is there anything we can incorporate into our diets to boost our health and immunity and protect us from COVID-19?
Yeah, that's a great question. I wish there was, being a bit of a foodie myself. The most important things to be able to boost the immune system are sort of the basic things in terms of eating a balanced and healthy diet and also getting enough rest. In terms of diet, I don't like saying what not to do, but it also then involves limiting things, not overdoing alcohol, and taking some of the basic steps that we all know are best for our health, and to stay strong and vigorous as much as possible. I would probably add the potential importance of tobacco. When we look at the mortality data from China, it's interesting, particularly among older people, there's a divergence in the risk of death, with men being at higher risk than women. And we know in China, particularly in people over age 60, the rates of cigarette smoking are very high, primarily among men, but not among women.
Great. Are you contagious during the incubation period?
Wow, that is a tough question. So it's one of those questions that we have been keenly interested in really from the first week of the response here back in January, because the period of infectiousness is critical to be able to limit spread of the virus. We do know that it is possible to be infected with the virus with no symptoms or very mild symptoms. And as some celebrities have become infected and shared their experience, we actually also see some anecdotal reports that have been shared about people who basically were sick at home for a few days, and then they're ready to go back and do things like play basketball. But the period of infectivity, it does appear that it's possible to become infectious shortly before the onset of symptoms. In general, it appears that the greatest period of infectivity is early in the course of illness.
And we did get a question about whether or not HIPAA covers health officials releasing the information of those who are ill, and I would just like to point out that they share that information themselves. It was not the health official. People have publicly declared, like Tom Hanks, that he has tested positive. That was not the health official violating HIPAA.
Right, and I was very careful not to name names, but also to being very aware of HIPAA as a physician, to not even necessarily quote what's in the media. That said, I think it's important to touch base with your own human resources consultants to know what is legal. It's not only federal regulations related to HIPAA, but there may be state and local laws that apply as well.
Okay, I think we have time for two more, and I've gotten these a couple times, so I would like to share those.
Go with the popular ones.
Do face masks prevent getting coronavirus?
CDC does not recommend use of coronaviruses in the community. There's not any good data to suggest that they are protective. The situations where we do recommend use of face masks are in healthcare settings, particularly when there's a likelihood of generating an aerosol of bodily secretions. The other scenario is when somebody is sick, coughing or sneezing. Wearing a surgical mask is a way to limit spread of that spray that's generated during cough or sneezing. So in that instance, it's not a matter of filtering out anything. It's more having a splatter shield over the face to limit spread of infectious droplets. Another point just to make is not only is there not data to suggest that wearing these masks in the community is effective, it's important to keep in mind the potential importance of putting your hands to your face. Just my own observation in some airports is I've noticed people who wear masks oftentimes are adjusting their masks and hence putting their hands to their face, trying to pull it down out of their eyes, adjusting the straps around their ears. Actually watched somebody on the escalator the other day that 5 times in just that one short escalator ride put their hand on the handrail, then put their hand to their face to adjust their mask.
And I guess last question is, can you compare the cases of COVID-19 to the number of cases of flu this year? Yeah,
it's important at the start in answering that question is recognize that COVID-19 virus is different from influenza virus. And probably some of those differences include the fact that children do not seem to be at higher risk of complications of COVID-19, as is the case for influenza, where we see the most severe illness in the very young and the very old. Kids, for reasons that we still don't fully understand, do not seem to be at risk of severe illness from COVID-19. Other ways that it's different, of course, is that we have vaccines for influenza. Sometimes we're not entirely excited about the effectiveness, but this year's flu vaccine seems to match the viruses pretty well, and it's about 50% effective. And it is important to get the flu vaccine, not because it provides any protection against COVID-19, but it is protection against the other, and right now in many areas, more prevalent respiratory pathogen that is circulating. So actually a number of our hospitals have been, over the past couple of weeks, approaching maximum capacity because of the stress from seasonal flu this year. And then the third area that's important to recognize is that COVID-19 is a new virus, so the population may have little or no pre-existing immunity to it. So we would anticipate that it's going to spread differently than an infection like influenza, where spread may be more limited because population is to some degree either immune due to vaccination or to recent infection by related strains of influenza. And just, I know another question that sometimes comes up is, what about mortality? Is it, in that sense, is it a virus that may kill more than influenza? We know that the reporting is probably underreporting. We've seen that from a number of areas that have had ongoing transmission for a while. So we may be more aware of the more severe cases. Our modeling has suggested it may be more likely in the range of about 0.5% to 1%, rather than some of the case series that suggest 3% to 4%. But I think it's important that we not take much comfort in that. If this is a virus that can infect the majority of the population, even 0.5% to 1% is a very significant number.
Okay. You want one more? Do you have time for one more?
Let's take one more.
Okay, thank you. Should we wipe down packages before handling them, especially packages that come from China?
Yeah, there's really not evidence that packages are going to be a mode of transmission, and I think it's important to recognize that while this virus first emerged in central China, it is a global epidemic now, and certainly the evidence is that most of the infection, if not all of it, is from person-to-person transmission, and that the hot spots now are really in the Middle East and in Europe. So maybe with that, Chip, we'll turn it back to you to wrap up.
Dr. Butler, we cannot thank you enough for spending some time with us today and helping provide information, which I think, as we all work through this situation, is without question the most important thing and the thing that may have been most sorely lacking up to this point. So thank you for providing facts and information. That is very helpful. We thank you to everybody who took some time out of their day to be part of this. We will post this on our website, so you will have access to it if anyone needs to go back and hear these answers again. We at AHLA remain here every day, willing to help answer any of your questions, so feel free to contact us. I know these are extremely trying times. There's no way I can properly capture the challenge that we're facing, but we will all be better off if we face it together. So rely on us. We'll do our very best, and thank you for participating today.